Dennis.
Yes, Karsten.
Tell me something about exposure. Exposure is such a big topic and not many people understand it. Myself, I don't understand it quite a bit. So, for example, let's look at your dog, Charlie, and you can see that that something is not right in this picture.
Right, you can see Charlie is overexposed, and you can see the background is a little bit darker. Now, as the photographer, you want your subject, in this case, the dog, to be exposed properly. But what the camera does, it basically balances the amount of dark to light. So since it saw a very, very dark background, the camera said, okay, I'm wanting to make it lighter. And as it made it lighter, as you can see, what I wanted to be the correct exposure was not.
Oh, so let me recap this. The camera sees a lot of darkness in the picture and says, oh my God, this picture is really dark. I need to lighten it up.
Yes.
A lot. Because there's so much black in the picture.
Yes.
Meanwhile, your dog is in the picture, which is white, and the camera doesn't light up only around the dog, it lights up everything. So not only the background becomes lighter, your dog becomes lighter too, and that makes him overexposed.
Exactly.
So how do you compensate for this one? Because in this picture, I can clearly see your dog, and the background is a little bit darker.
Exactly, and on all of your cameras, there's something called exposure compensation. It goes to the minus or to the plus, depending on what you want. If it's, for example, if it's a snow scene, as we have today, and the camera sees everything very, very white, a lot of white, it's going to automatically do what? Make it darker. Well, if you take a picture of your subject, so you've been skiing all day, your subject is dark, and many of you have seen that. So either you have to turn your flash on if you're close enough, or there are dials or settings on all of your cameras called exposure compensation. It goes either negative or positive, depending on if it's a very, very black background, like this one, or a light background. So you can set it the way you want it for your subject. Now, interestingly, because you might say, well, how does this relate to anything in dentistry? You might think it doesn't, but it can. For example, if some of you have a dark background, okay, you have black or dark blue or something dark behind the patient, and your patient has dark complexion, okay, and you just put your camera on automatic, like we've been talking about, and you make a picture, then what happens is the camera sees a lot of darkness, makes it too bright, and the teeth are like Charlie, are like overexposed.
I'll give you another good example. If people in the dental lab take photos of diagnostic wax-up, of white wax-ups, then the background is usually black, but the wax-up is white.
Exactly. What do you get?
So the camera tries to compensate for this background and overexpose your white wax-up, which means you don't see any details anymore.
So the real comment needs to be, what do you do about it? And that goes back to the advantages that Karsten we talked about earlier. When you put your camera on manual, and you put your lens on manual, and you preset the exposure settings and everything else, then you're taking control of the picture and you won't have that problem.
Exactly. That's a good point.